When you're looking for a senior living community, you want one of the best, one that is elegant and comfortable, that offers so many amenities and has an incredible team of folks behind you. And let me tell you, one of the best around is our coastal expert, Savannah Square. And joining me now to talk about Savannah Square is John Mahan, Director of Nursing. Hi, John.
Hey, how
it's
are
great
you?
to see you.
Nice to see you.
So let's talk about Savannah Square, because I always say it really is like no other. It's absolutely a beautiful community. Can you describe it more for our viewers?
Sure, so we're unique in that we are a CCRC, so we allow individuals to age in place depending on their level of care that they need. We have skilled nursing, assisted living, and even independent living. So our community is unique in that we are not focused on one level of care. We can address all levels of care.
It really is a full service community.
Correct.
That is just really like no other. You know, how often is a doctor present? Because I know that you guys get that question probably a lot.
Right, so our medical director is present every Wednesday, and she rounds on all of her patients every Wednesday. Her nurse practitioners are present on Mondays and Fridays, so we have a medical presence 3 days a week, and I believe that that'll be hard for you to find anywhere else in the community.
And this is a large community. I mean, we're not talking about just a few residents staying in this community. How large is it?
We service over 200 residents total. The health center, which is the skilled nursing division, and that includes the rehab and therapy. We are 40 beds. We offer physical therapy, occupational therapy, and speech therapy. We also do skilled nursing, which is essentially short-term rehab, and then if someone needs long-term care, we also provide that as well.
Let's say someone is looking at Savannah Square and they've chosen that as their senior living community. What can families expect once their loved ones are admitted?
So within the first 48 hours of admission, we offer an admission care plan meeting, and what that is we sit down with the family or the resident or both, and we develop a plan of care that's basic, but we want to all be on the same page. As you just came into the community, what are your goals for yourself? How can we help you meet those goals?
Because it's not a one-size-fits-all. I mean, because each person probably has their own individualized care and their own program. So how is that type of care determined for each individual resident?
So in addition to the 48-hour care plan meeting, we offer them quarterly and on an as-needed basis. So if an issue arises, social work would reach out to the family or responsible party, and we would all sit down, and we want to get to know that resident. What are their specific likes or dislikes with food or activities or care? What timing is best for them? What can we do to help them reach their prior level of function? And we want to be as specific and individualized as possible.
And you must have an incredible team behind you. I know you're Director of Nursing. I mean, talk about your team.
So our team consists of a medical director, a nursing home administrator, director of nursing, assistant director of nursing, and then we have direct care staff, which are licensed nurses, RNs, LPNs, and we have licensed CNAs. And we have 24-hour round-the-clock nursing care, and a registered nurse is on call 24 hours a day to respond to any needs that might arise. You
know, you mentioned goals. How do you assist residents in attaining their goals? Because I know that each resident is probably different.
Right. So most residents either have a nursing related issue or they are there for therapy and rehab to reach their prior level of function. My focus as the Director of Nursing is removing those medical or nursing barriers so that a person can fully participate with therapy and meet those goals. We set those goals in the care plan, and I want to make sure the nursing staff is focused on, pain, infections, any kind of blood pressure issues, any kind of medical issues that might hinder their ability to reach their full potential. We want to address that and make sure those are limited so they can prosper and get back to where they were previously.
You know, we hear about 5-star senior living with Savannah Square. Describe the 5 dimensions of wellness, which is exclusive to 5-star.
Right, so that's unique to 5-star. We have a Lifestyle 360 program, which is essentially our activities program, and we focus on the spiritual wellness of a person, the social wellness of a person, the emotional wellness of a person, intellectual and physical. All of those are important. We really stress the intellectual and physical. Intellectual because promoting a cognitively active environment. Actually, a study was done by the American Academy of Neurology that shows people who stay cognitively active have a decreased risk of developing Alzheimer's. So that's a real strong focus in our program. We also focus on the physical and promote that because a physically active lifestyle promotes a person's ability to remain independent.
Well, John, I want to thank you for joining us today and providing so much valuable information to our viewers on Savannah Square. And I want to thank you also for all that you do for the residents at Savannah Square.
Thank you, and I appreciate your time and the ability to speak to the community about Savannah Square.
Thanks so much for joining us. It's always great to see you.
Thank you.
If you'd like more information on Savannah Square or senior living or any of our coastal experts, just go to our Coastal Experts page. You'll find that at wsav.com.